When it comes to vein problems in the legs, there are many common questions that we get asked. Some of the more common questions are, how did this happen? Well, there are many answers to that, and they can include genetics. So if your mom, your dad, your grandma, or your grandpa had vein problems, well, then you have a very high chance of having similar issues. Also, pregnancy is a common one as well. The more pregnancies that you have, the more likely that you may end up developing vein problems in the legs. Occupation can also be a reason that someone develops vein problems. If we stand or sit for long periods of time, we may get problems. And sometimes, unfortunately, we don't know why this happens, but whether it's because of heredity or because of pregnancy, or we don't know why, the symptoms and the treatments don't change. Is my treatment vein stripping? Well, if you don't know what vein stripping is, I'm here to tell you that it was a brutal procedure. Not fun. For most patients, if that was the only treatment available, I wouldn't recommend it. The good news is now, vein stripping should almost never be done in the United States. There are much more elegant, much more advanced treatments available to you that limit downtime, limit pain, and improve outcomes in a significant way. Is treatment going to be covered by my insurance? Unfortunately, a lot of patients are told that their issues in their legs are cosmetic. For some people, that may be true. But for the vast majority of patients, if you have more going on in your legs other than just, I don't like the way my legs look, most insurances recognize that underlying vein problems are a medical condition. And by recognizing this, treatment is over 95% covered by a patient's insurance. So does treatment hurt? Well, I like to joke with my patients and say, it doesn't hurt me a bit. But honestly, the treatments now, because they're so minimally invasive and because they're so much more elegant, most patients feel little to no discomfort during treatment or after treatment. Good news is, after treatment, because it's so minimally invasive and so much more elegant, downtime after treatment is typically minutes, not days to weeks like it was with the old school vein stripping that most people have cold night sweats and nightmares about. Most patients after treatment, they're walking out of the office within 10 to 15 minutes after treatment, and they can drive themselves home. What's amazing about these new procedures is that regardless of the medications that you're on, whether it's a blood thinner because of heart problems or past blood clots, diabetes medications, heart medications, or really any medication at all, you are not required to stop any of your medications. You do not need to fast before your treatment. You basically take your medications as your physicians order, eat good breakfast or lunch, come in, and let us take care of you. Yes, you can drive yourself home after treatment because the treatments for vein issues are now done just using local numbing medicine. Within 10 to 15 minutes after the treatment, you can walk out of the office and drive yourself home and resume normal activities that day. After your vein treatments, you will need to wear compression on your treated leg for at least 5 to 7 days after the treatment. This is to help with any swelling or bruising or post-procedure discomfort. The goal after treatment is that you won't need to wear compression on a daily basis. So why do I have to wear compression socks? Well, there are many answers to this question, but the most common is that in order to potentially treat any underlying vein issues in the legs, your insurance may require you to try wearing medical grade compression socks for at least 6 to 12 weeks. Now, the way I want you to think of this compression is a lot like wearing glasses if you have bad eyes. You wear the glasses, you see better while you have them on. But when you take them off, you still have the same cruddy eyesight. The same thing happens with the veins. You wear compression, and this can help support blood flow and improve the blood flow in the legs, but it's not treating the underlying problem. So once you've completed this compression trial that's required by the insurance, most patients then choose to move forward with treatment. The goal of treatment is to make improvement more permanent. The most common reason that a person has a wound on their legs, or they have swelling, or they have skin darkening and texture changes is actually not diabetes. Most of these patients are suffering from undiagnosed, untreated vein problems in the legs. Now, to be honest with you, complications from diabetes and complications from undiagnosed and untreated vein issues in the legs can actually mimic each other and can complement each other in a very negative way. So could diabetes be a potential underlying contributor? It absolutely could. But is it typically the real underlying reason why you're having problems? Generally not. Most people are also suffering from vein problems in the legs that can be painlessly and efficiently diagnosed and treated with minimal pain and little to no downtime.